10. Warning signs of blocked arteries in your legs and feet. Don't ignore these signals. What if I told you that right now, as you're watching this, your legs could be silently starving for oxygen, and you wouldn't even feel it? Peripheral Artery Disease, or PAD, is one of the most underdiagnosed conditions in the world. It affects millions of people. It can lead to amputation. It can lead to stroke. It can lead to death. And the terrifying part? Most people ignore the signs for years. Stay until the end, because sign number 10 could literally save your life or the life of someone you love. If this is your first time here, welcome. If that sounds like something you need, hit that subscribe button and the bell right now. Let's get into it. What is peripheral artery disease? Before we jump into the signs, let me quickly explain what's actually happening inside your body. Because once you understand it, the symptoms will make perfect sense. Your arteries are like highways. They carry oxygen-rich blood from your heart to every part of your body, including your legs, feet, and toes. Now imagine that highway getting narrowed, clogged, blocked by a buildup of plaque, cholesterol, fat, and calcium deposits that harden over time. That condition is called atherosclerosis, and when it happens in the arteries of your legs, it becomes peripheral artery disease. When blood can't flow properly, your muscles and tissues literally start to suffocate. They send out distress signals. Those signals are the warning signs we're about to cover. So, let's talk about them, starting with the one that most people dismiss as just being out of shape. Sign number 1 is called claudication, and it's the classic hallmark of PID. Here's what it feels like. You're walking, maybe a few blocks, maybe up a staircase, and suddenly your calves, thighs, or buttocks start cramping or aching. It's not a sharp pain. It's a deep, tired, cramping pain that forces you to stop. But here's the thing. The moment you rest, the pain goes away, usually within 10 minutes. And then you walk again, and it comes back. That cycle of pain, rest, relief, pain again, that's your muscles screaming that they're not getting enough blood. Most people think it's just aging, or being overweight, or not exercising enough. They push through it for years. Don't do that. If you experience pain in your legs only during activity that relieves with rest, that is a red flag that needs medical attention immediately. The sooner PAD is caught, the more options you have to treat it. Sign number 2 is something most people completely overlook, and it's cold feet. Not the nervous kind, the literal kind. Now, cold feet can have many causes, but there's a very specific pattern with PAD. One foot or one leg feels noticeably colder than the other, even when you're warm, indoors, and at rest. Why does this happen? Because poor blood flow means less warm blood reaching the extremities. The foot or leg furthest from the heart, or the one with the most blockage, gets the least blood, and therefore the least warmth. Here's a simple test you can do right now. Place one hand on each foot. Do they feel the same temperature? If one foot is consistently colder than the other, not just occasionally but consistently, mention it to your doctor. Also notice this. If your foot feels cold but looks pale or bluish, that's an urgent sign. Don't wait. Sign number 3, numbness or weakness in your legs or feet, especially when you're walking or exercising. When arteries are blocked, muscles and nerves don't get the oxygen they need. The result? A heavy, weak, numb sensation in the legs, like they're made of lead. Some people describe it as their legs giving out or feeling like they can't lift their feet properly. Now, numbness in the legs can also be neurological, like sciatica or diabetic neuropathy. But here's the key distinction with PAD. The numbness or weakness comes on with activity and improves with rest. If it's happening at rest, that's actually a sign that PAD may have progressed to a more severe stage, called critical limb ischemia, and that requires urgent medical care. Don't self-diagnose. If you have this symptom, see a vascular specialist. Sign number 4 is something you can literally see, and it's changes in the color of your skin. People with PAD may notice their legs or feet turning pale or white, especially when elevated, blue or purplish, a color called cyanosis, when deprived of oxygen, red or reddish-purple when hanging down, because gravity is the only thing pulling blood into the limb. Here's a telling sign doctors actually use. Elevate your leg for about a minute, then dangle it down. In a healthy leg, the color returns quickly, within a few seconds. In a leg with poor circulation, it takes much longer, and the foot may turn an unhealthy deep red. If you look down at your feet right now and notice a pale, waxy, or blue tint, especially if you've never paid attention to it before, please see a doctor. These are visible signs that your tissues may not be getting adequate blood supply. Sign number 5 is one of the most dangerous warning signs because it signals that PAD has progressed significantly. Normally, when you get a cut or sore on your foot, your body sends healing blood, full of oxygen, nutrients, and white blood cells, to repair it. That wound closes up in days. But when arteries are blocked, that healing blood can't get through. The wound just sits there. Days turn into weeks. Weeks turn into months. These non-healing wounds are called ischemic ulcers, and they're serious. They commonly appear on the toes, heels, and the bony prominences of the foot. They're particularly dangerous for people with diabetes because neuropathy means they often can't feel the wound getting worse. If you or someone you know has a sore on the foot or lower leg that simply won't heal, that is an emergency. Untreated, these wounds can become infected, and infected tissue that has no blood supply? That's how amputations happen. I cannot stress this enough. A non-healing wound on the foot, see a vascular doctor today. Sign number 6 might surprise you. It surprised me when I first learned about it. Look down at your legs and feet. Do you have hair on your legs? On the tops of your feet? On your toes? If the hair on your lower legs or feet has thinned out dramatically or disappeared entirely, especially if you're not older and haven't shaved it, that can be a sign of PAD. Here's why. Hair follicles need a steady blood supply to grow hair. When that blood flow is compromised, follicles can't function properly, and the hair simply stops growing. Now, leg hair does naturally thin with age, so this sign is most significant when combined with other symptoms on this list. But on its own, in a younger person, it can be a very early clue. Quick check right now. Roll up your pants. Look at your shins and the tops of your feet. If they're noticeably bare, especially on one leg more than the other, that asymmetry deserves medical attention. Sign number 7 is one your doctor specifically checks for, but you can actually check yourself. You have 2 major pulse points in your feet, one on the top of your foot, called the dorsalis pedis pulse, one on the inside of your ankle, called the posterior tibial pulse. A healthy person should have a clear, strong pulse at both of these points. If the pulse is very faint, or if you can't feel it at all, that's a strong indicator of reduced blood flow from arterial blockage. Now, to be fair, feeling your own foot pulse isn't easy, and some people naturally have deeper pulses. But doctors use this check routinely. If a doctor cannot find your foot pulse with 2 fingers or even a Doppler ultrasound, that's a major red flag for PAD. Ask your doctor at your next checkup, "Can you check my foot pulses?" It's a simple 30-second test that could reveal something significant. Sign number 8 is subtle, but once you know what to look for, you'll see it clearly. Look at the skin on your lower legs and feet. In people with PAD, the skin often takes on a specific appearance. It may look shiny, almost waxy or glazed. The texture may look tight, like the skin is being pulled over the bones. The skin may also appear thinner and more fragile than normal. In some cases, you may notice the skin starting to crack or peel at the heels without obvious cause. What causes this? Again, lack of blood flow. Healthy skin needs a constant supply of oxygen and nutrients. When that's cut off, skin cells start to change and deteriorate. The sweat and oil glands stop working properly. The result is that characteristic dry, tight, shiny appearance. Combined with hair loss, coldness, and color changes, shiny skin is part of a picture that vascular doctors call trophic changes. Tissue changes caused by chronic lack of blood supply. If your skin looks like this on your lower legs or feet, it's time to get evaluated. Sign number 9 is one that almost nobody connects to their legs, but it's critically important. For men, erectile dysfunction, especially in men under 60, can be an early warning sign of systemic atherosclerosis, the same process that blocks leg arteries. The arteries that supply the pelvis are often affected before the larger leg arteries, making ED one of the earliest indicators of vascular disease. Studies show that men with ED have a significantly higher risk of cardiovascular disease. If you're experiencing ED, especially with any other signs on this list, please talk to your doctor. Not just about the ED, about your vascular health as a whole. For women, PAD often presents differently, with fatigue, heaviness, or aching in the legs rather than classic cramping. Women are more likely to be misdiagnosed or told their symptoms are just arthritis or just getting older. Women, advocate for yourself. Ask specifically to be screened for peripheral artery disease. This sign is a reminder that PAD doesn't happen in isolation. It's part of a body-wide process. Getting it checked could reveal heart disease, carotid artery disease, and other serious conditions at the same time. And sign number 10 is the one I hope none of you ever experience. But you need to know about it because if it's happening to you or someone you love, every hour matters. Gangrene. When tissue is completely starved of blood for too long, it begins to die. The toes, the furthest point from the heart, are usually the first to go. They turn dark blue, purple, then black. The tissue dries out and hardens. That's called dry gangrene. Or it can become infected and weep fluid. That's wet gangrene. And that can become life-threatening within days. If you see a toe or part of a foot turning black, or you have an overwhelming smell from your foot, or you have excruciating pain in your foot at rest, especially at night, do not wait for a doctor's appointment. Go to the emergency room. This is the end stage of PAD, critical limb ischemia, and it often requires emergency procedures to restore blood flow. Without immediate intervention, amputation is likely. The terrifying truth is that most people who reach this stage had years of earlier warning signs that they ignored or weren't recognized. That's why this video exists. That's why you need to share this video with everyone you know. What causes blocked arteries in the legs? So what causes this to happen in the first place? The number one cause of PAD is the same process that causes heart attacks and strokes, atherosclerosis, the buildup of plaque inside the artery walls. This is driven by smoking, the single biggest risk factor. Smokers are 4 times more likely to develop PAD. Diabetes. High blood sugar damages artery walls over time. High blood pressure pounds away at vessel linings for years. High cholesterol provides the raw material for plaque buildup. Obesity, particularly abdominal fat, which drives inflammation. Sedentary lifestyle. Physical inactivity allows plaque to accumulate faster. Age. Risk rises significantly after 50. Family history. Genetics plays a real role. The more of these risk factors you have, the higher your risk. But here's the critically important message. PAD is preventable. And even if you already have it, you can slow it down significantly through lifestyle changes, medication, and medical procedures. But it all starts with catching it early, which is why knowing these signs is so powerful. Who is most at risk? Are you at risk? Let me be direct about who needs to be especially vigilant. You are at high risk for PAD if you are over 50 years old, especially if you smoke or have diabetes, are over 65, regardless of other risk factors. Are any age with diabetes and at least one other risk factor, have a known history of heart disease or stroke, because the same plaque that's in your heart is likely in your legs, are African American. This group has twice the prevalence of PAD compared to white Americans, have chronic kidney disease. If you fall into any of these categories, I strongly encourage you to ask your doctor for a simple screening test called the ABI, the Ankle Brachial Index. It takes about 15 minutes. It compares the blood pressure in your ankle to the blood pressure in your arm. It's painless. It's accurate. And it can detect PAD long before symptoms even begin. Don't wait until you're in pain. Ask for the ABI at your next appointment. What to do if you have these symptoms. What you need to do if you recognized yourself in any of these warning signs. Here's your action plan. Step 1. Don't panic. But do take it seriously. PAD is treatable when caught early. Step 2. Write down your symptoms. When do they happen? How long have you had them? What makes them better or worse? Doctors make better decisions with specific information. Step 3. Call your doctor this week and specifically ask, I'm concerned about my circulation in my legs. I'd like to be screened for peripheral artery disease. Can I have an ABI test? Step 4. If you are experiencing pain at rest, a non-healing wound, or any blackening of the toes, do not wait for an appointment. Go to urgent care or the ER. Step 5. In the meantime, if you smoke, please begin working on quitting today. It is the single most powerful thing you can do to slow the progression of PAD. Nothing else comes close. And finally, start moving. Even supervised walking programs have been proven to improve PAD symptoms. Your legs can literally grow new blood vessel pathways around blockages, a process called collateral circulation. Your body wants to heal. Give it the chance. Here's what I need you to do right now. If this video gave you anything, a new awareness, a symptom you recognized, a piece of information that might save your life or someone else's, then please do 3 things. First, hit that like button. It takes 1 second, and it tells YouTube that this health information is worth sharing with more people. Every like helps get this into the hands of someone who needs it. Second, hit subscribe and the bell. I make videos like this every single week. Videos about heart health, circulation, metabolic disease, the warning signs that doctors don't always have time to explain. If you want to stay informed and take control of your health, this channel is your resource. Don't miss another video. Third, and this one could literally save a life, share this video. Right now, someone in your life, your parent, your partner, your friend, may be experiencing these symptoms and dismissing them as just aging. Share this with them. A simple message, hey, you should watch this. That's it. That could be the moment that changes everything for them. PAD is called a silent killer because people ignore the signs. But now you know the signs. Now you can speak up for yourself and for the people you love. Thank you so much for watching. I'll see you in the next one.